Yeah, hello. Sanibona lapho any live everywhere. Ngiyazi ukuthi abaningi bese beyibuza ukuthi are we still running these talks. Apparently Runner a lot. Of course it's been July. Isn't busy every now, every corner, every surgery. There are a lot of health matters, as you know, since it's winter. So welcome back to our page. Welcome back to these talks. So namuhla we're gonna focus on some topics. Kodwa ngicela ukuthi ngiqale ngayo is something which has to do with mental illness, because siyazi ukuthi July is a mental illness awareness month, and siyazi ukuthi since sihlala eMaritzburg there's a lot of mental institution. At some point in time when I grew up, I always knew ukuthi umuntu uma ngabe gula uzoyise eMaritzburg, because that's where ibhedlela eziningi ze-mental here. So la eMaritzburg we know ukuthi there is Town Hill, there is Fort Napier dealing with mental health, and each and every hospital does admit mental health, especially acutely within 72 hours for monitoring. But other institutions was deal no mental health are specialized. You can't. There's also a Harwick hospital at Dila, particularly with the mental health. They deal with mental health. Even at Tegwin, we know when I used to study Nelson Mandela, there was some other hospital, like King George was practically a mental health hospital, and I know what now it's a district health hospital. They've actually increased it level. Kandi, apart from mental health specialized hospitals, akhona amanye ama-hospitals deal practically specialized was ukuthi sibhedlela deal with one aspect of health. We know what TB, the public health concern, which is tuberculosis, has got a specialized center where they treat particularly this infectious disease. We've got Doris Goodwill. There used to be one at Richmond, but after COVID then it was shut down. Greytown, they've got TB hospital. We know there was two. There was Charles James, and then there was also King George. There's King George now, which actually has been turned into a nice, beautiful establishment that deals with tuberculosis, particularly. How do I know about this? Because my research was based on it was an occupational health research, master's research, which dealt with to evaluate the impact of occupational TB in healthcare workers. You know, are healthcare workers more exposed to TB than general population, and how, in fact, it was evaluating the impact of controls, because it was occupational health, assessing whether the controls that are there with TB prevention, the use of PPE, the mechanical ventilators and everything else, administrative protocols, whether are they effective in preventing tuberculosis amongst the healthcare workers who are exposed there. Ngelinye ilanga, I will unpack with what were the results of these studies that are done as part of occupational health education at UKZN with my supervisor, Dr. Paswan. So I was just touching there so that we get an understanding there are specialized centers, what exactly are we talking about, and they're not only with psychiatric illnesses, but there are also other specialties. You can get like I specialize in eye hospital, cardiology, or heart hospitals, things like that, and they are private as well as government. So today, to honor the health awareness, the mental health awareness month, we chose the topic of depression to talk about it. Basically, one will ask why depression, because depression is the one that causes a lot of comorbidities, and it hides because it's a mental illness. So when someone has it, they try to hide it until we are surprised by devastating effects of what it can do to people, right? When people hurt themselves, hurt others, and then others eventually commit suicide. So my first question says, what is mental health, mental health, well, everyone I'm sure what already has what they think what it is the meaning, but it has to do with the health that includes what? The emotions, the psychological aspect, and the social well-being. So it deals with how people actually think and feel and act, and how they relate to events that happens to their life, basenglisha kanjani stress, and then how do they make choices, in life. And then mental health as well is important at every stage of development, from pregnancy, when the mother is pregnant, even when the child is being conceived. If the child was not conceived in the right way, it will show with their mental health. It can affect the mother, if the mother is in an abusive relationship, and then maybe have to take antidepressants. They can have even an impact in the developing baby. Even when the baby is born and it's exposed to a lot of trauma, then that will display later on in life, and in childhood, adolescence, even in adulthood. So we must look after the mental health throughout, in fact, throughout the days of our lives, and make sure that we relate well with people, and we avoid a lot of external factors that can cause and become stressors in our life. Eliminate factors and people that can even cause unnecessary stress. Yes, we live, ne?